So the stomach virus hit our house last week. My 18-month-old brought it home from school and it went through all of us except for somehow it skipped my husband this time. I was laid up in bed for a full 24 hours. So I wanted to tell you what we did for the kids at home so that you can save this and pull it out when inevitably the stomach virus hits your house. And then also make sure that you read the caption. I'll tell you when I would have taken them into the doctor or to the ER. So first of all, let's talk about the normal course of a lot of stomach viruses. Not always, but usually what happens is you will start with vomiting that lasts 1 to 2 days, potentially a low-grade fever, and then unfortunately after the vomiting subsides, a lot of times that's when the diarrhea starts, and it can last up to 14 days. So do not panic. As long as it is improving and your kid is doing everything else normal, but they're just having 1 or 2 loose stools a day for up to 2 weeks, that's okay. So what I did for my kids, first thing I did is call the pediatrician and ask them for Zofran. However, I did not give it. This was for the 2 older kids, and this was just in case I needed it because my #1 goal is to prevent dehydration. However, I don't want to give them Zofran unless absolutely necessary because they need to get all of that out of their body, and Zofran can unfortunately actually prolong the virus because then they're not getting it out. I ended up not needing to use it for them. I did need to use it for myself. Next thing is hydration. So for the little babies younger than what I have in my house, I would give them whatever they normally have. If that's formula or breast milk, just focusing on probably smaller sips, maybe using a syringe and just giving them like 5 milliliters at a time. And then potentially an oral rehydration solution like Pedialyte. For the older ones, same thing, smaller sips of water or Pedialyte. Something that's going to help replace those electrolytes is actually better than water, but I'm going to stay away from sugary drinks like juices because those could potentially make the diarrhea worse. If they are eating, I'm definitely not forcing this, but if they are, I'm focusing on really plain, simple food. Think pretzels, pastas, bananas, toast, things that are going to go down really easy and just little bits at a time and then slowly start to add up from there. If they're still in diapers, I go ahead and just always use a barrier cream like Bordeaux butt paste or even just plain Aquaphor works great just to help protect their skin from all that diarrhea. And then of course, if anything is worsening or not improving, then I'm going to call the doctor, but read the caption for the full list of when I would go to the ER or when I would call my physician, and make sure you save this for when you unfortunately need it.